want to start, if you don't mind, by talking about the reason that you actually quit the NHS in 2015, because you had a very traumatic situation with a girl who had a life or death emergency, and you really didn't feel that you had the support and backing that you required to do a good job.
Yes, thank you. Good morning. I quit when I was 56 in 2016, and the overriding reason for that was I realised that I was vulnerable to being exposed without any junior doctor's support. What happened was there was a girl who was born called Grace. She hasn't asked for anonymity, so I can mention her name. And she was critically ill, and the registrar left to go home and left me by myself on site. And that was a terrifying experience. So after that, age 56, I realised that it was getting more difficult to do on-call, and the risk to my working practices was increasing if I was going to be vulnerable to having to work by myself with critically ill babies.
And of course, it's a tragedy to lose somebody like you from the National Health Service with decades of experience and at the top of the industry, if you want to call it that, as a consultant. But this is a picture that you've seen for yourself across the NHS. Lots of consultants leaving their jobs, lots of posts. We hear about 47,000 nurses' posts not being filled. And so you've written this book about the problems that you have seen within the NHS. And what is the sort of overriding message that you want people to take from that?
Yes, I think the government talk about recruitment, and I think retention is probably more important. There's not much point. We're like a sieve at the moment. There's not very much point keeping pouring water in at the top if it falls out at the bottom. And we need to work on a way of keeping the senior clinicians, nurses, doctors and other health staff in the NHS. I accept that the more senior members of staff cost more money. I accept the more senior members of staff probably are pricklier and maybe more difficult to deal with. But they're very good value for the country, and we need to keep these people in, so we need to respect them.
Well, in the book, you talk about a sort of unhelpful characterisation of doctors by politicians and also by journalists. What do you mean by that?
Please repeat. What do I say in the book about them?
Well, yes, just explain to me how you feel as though doctors like you were being mischaracterised by people like me, and you know, how important it was for the public to judge the health service on the facts rather than on the way it's sort of being presented to them.
OK, I think my view is that the government have perhaps misled the press, and the press have perhaps therefore misled the public on how the NHS works. So the purpose of my book was try to explain to the public how we work. I came to the conclusion I had to write this book not in the best of health, because I was surprised by my non-medical friends and their lack of understanding of what it's actually like working on the front line, either as a doctor, or as a nurse, or as a porter, or as a receptionist, or as a secretary. And I had the feeling that the people outside of the National Health Service struggle to comprehend the environment that we work within. And I think the reason for that is that the government misrepresent our environment. For example, they...
Yeah, go on.
No, they talk about increasing recruitment, but they don't actually talk about the number of people who are actually there. That's just one example.
OK, and look, some people would argue, and many have, that people like you have been arguing this for a while, but actually, finally, the public are seeing the challenges that are there because their experiences are so poor now when they're going into A&E and having to wait or having operations cancelled because of this industrial action, which is as a consequence of those working conditions that you describe. But in your book, it's not all doom and gloom. You do come up with some solutions of how you see what you believe to be a sacrosanct institution being saved. How do you think the NHS can be reformed and turned around? What needs to be done? Besides just more money, please don't just say more money.
Yes, well, I think to start off with, the NHS probably needs to be removed from the hands of the politicians. I can't believe there are many politicians who are brave enough to stand up and risk their jobs and their pensions by saying that they've failed and that the NHS has failed and things have to change. So I do believe that the NHS must change. And the first thing I would do is I would accept that we can't do everything for everybody. When I qualified at age 23 in 1983, I did believe this. However, now I don't believe this. And there are many reasons for this. And we in the UK are the only country in the world who tries to do everything for everybody that is free. Nobody else attempts this. And I feel that we're standing in a room full of spinning plates, and all the while we're surrounded by the frequent sound of smashing crockery. So I would look at creating a body that is apolitical, that looks at how we can improve matters. The first thing I would look at is being open about rationing, because we cannot continue to do everything. I would then look at our NHS litigation situation. We currently have put £80 billion aside for NHS litigation. Now, politicians talk about how much it costs to pay the staff. They spend approximately £60 billion per year. £80 billion has been put aside for NHS litigation. Other countries run systems such as a no-fault compensation in New Zealand, and I can see no reason why we can't do that. And finally, I've talked about this business about us being a sieve, and we really need somebody to put the plug back in the bath, because the senior staff, the experienced staff, do cost more. They are pricklier, but they are very important and they're essential for the safe running of the NHS.